Hey everyone, this video is Chapter 12, Sections 12.1, 12.2, and 12.3. Overall, we know that the nervous system is a very complex system. It is absolutely critical for how we think, how we feel, our personality, and the behaviors that we choose to do. When we talk about neurobiology, we're combining those behavioral aspects along with life science. So specifically here in section 12.1, we're going to be talking about the overall functions of the nervous system and then some of the major forms and functions that the nervous system can be divided into. There is some overlap and similarity between the endocrine system and the nervous system. So we want to make sure that we're talking about these distinctions pretty carefully. The endocrine system uses chemical messengers that we commonly call hormones to communicate, and these things travel through the blood. The nervous system, in addition to using chemical messengers, also uses electrical signaling. Okay, so endocrine is only chemical and nervous is chemical and electrical. The nervous system can also transmit messages in a cell-to-cell manner. The nervous system has three basic functions. First, we receive information through our sense organs and are able to decode changes about the external environment and about our internal environment in the body and transmit messages to the brain and to the spinal cord. And the brain and the spinal cord make up the central nervous system, or CNS, central nervous system. The central nervous system then processes that information, compares it to experiences that we've had in the past, and then works to find an appropriate response. The central nervous system, as a response, can communicate with muscles and glands to take action. We've talked about the central nervous system a little bit, which is one of the two major subdivisions of the nervous system. And the central nervous system consists of the brain and the spinal cord. And of course, the spinal cord is enclosed by the vertebral column, and the brain is housed in the cranium that we've talked about previously. In addition to the central nervous system, we have the peripheral nervous system. The peripheral nervous system is all of the nervous tissue except for the brain and the spinal cord. We have two main cell types here, nerves and ganglia. And nerves are bundles of nerve fibers, or axons, that are wrapped in a fibrous connective tissue. Ganglion are knot-like swellings in the nerves, and this is where the nerve bodies are found. The peripheral nervous system contains the sensory and motor divisions, and we can divide it into somatic and visceral subdivisions. So the sensory portions, they carry signals from different receptors, such as in the skin or the muscles or the bones or the joints, into the central nervous system. The visceral sensory division then carries signals from the viscera, or internal organs, kind of the soft tissue, the heart, the lungs, the stomach, and the urinary bladder, for instance. Now, the motor system is a little bit different. It's also divided into somatic and visceral, but the motor, also called the efferent division, carries signals from the central nervous system to the glands and muscles that carry out the responses. Okay, so in the somatic division, we're carrying signals to the skeletal muscles. This is causing both voluntary and involuntary muscle contractions. And then the visceral motor division, we call this the autonomic nervous system. So this is going to carry signals to the glands, cardiac, and smooth muscles. The visceral motor division can be further subdivided into two categories. We have the sympathetic division, which is what we use when we need to take action. So if we need to increase the heartbeat, increase the rate of breathing, those things often go along with inhibiting the digestive and urinary systems. On the other hand, the parasympathetic division generally has a calming or sedating effect. It is responsible for slowing the heart rate and breathing, and conversely, stimulating the digestive and urinary systems. Okay, so here's a nice visual of this. We have the central nervous system, the brain and the spinal cord, and the peripheral nervous system is everything other than the brain and the spinal cord. Okay, so we can divide the peripheral nervous system first into the sensory division and the motor division, and then each one of those can be divided into the visceral sensory, somatic sensory, visceral motor, somatic motor. And then we can make one more subdivision of the visceral motor into the sympathetic, accelerating the heart rate and breathing, and parasympathetic, calming the heart rate and breathing. So moving on to section 12.2, here we're going to be talking about the three functions that all neurons have, the three categories that we can divide neurons into based on the functions. We'll talk about the anatomy of a neuron and how within a neuron, from the cell body of the neuron to the tips of the axons, we are able to transport materials within that neuron. So here are the three universal properties. Very, very important here. We have excitability. Sometimes you'll see this as irritability, kind of an antiquated word. So excitability is what we typically go for here. Excitability means we can respond to stimuli in the environment. Conductivity is how we respond to that stimuli. And in this case, it's going to be through electrical signaling. Okay, remember this is different than the endocrine glands when we only have chemical signaling. Here with neurons in the nervous system, we have electrical signaling. And finally, secretion. Okay, so when the electrical signal gets to the end of the nerve, what happens? Okay, this is where the chemical signaling comes in, and neurotransmitters, which are chemicals, get secreted from one cell and influence the next cell in the chain. So now we're looking at the three classes of neurons. We talked about the three main functions. Now we have three classes. So first we have sensory, sometimes called efferent neurons. So the sensory neurons are the things that detect the stimuli or detect the change in the environment and send that information to the central nervous system, to the spinal cord or the brain. Then we have interneurons. Interneurons are found completely within the central nervous system. And these connect the motor and the sensory pathways, and this makes up the majority of your neurons. And then finally we have the motor or efferent neurons, and these are the ones that are going to send the signals back out to the muscles or the glands and cause whatever signal that's going to impact on the muscles or the glands. So now we're going to talk about what a nerve looks like and what a neuron is made of. Okay, so the first thing we have the neurosoma. The neurosoma, sometimes it's called the cell body. The neurosoma is the central body of the cell. It has a large nucleolus, usually just one, usually located somewhere close to the center. The neurosoma is where we're going to find the mitochondria, lysosomes, Golgi, rough ER, smooth ER, cytoskeleton, all of those things that we think of as cell organelles. Inclusions are something that you probably want to take a look at here. So inclusions are glycogen or lipids or melanin or other pigments that are part of the neurosoma. And then the cytoskeleton is really important for us because it allows some compartmentalization to happen. You might want to note that because we don't do mitosis, neurons, generally speaking, don't divide. We don't have centrioles found in the neurosoma. Okay, so the next thing we're going to talk about is the dendrites. The dendrites, we can see them up here. These are the highly branched pieces. They come off of the neurosoma. So here's our neurosoma with the big nucleolus and nucleus. And the dendrites come off of it. This is where we receive signals. Okay, so signals are coming into the dendrites. The more of these dendrites that we have, the more signals that can be received simultaneously. So the signals come into the dendrites to the neurosoma, and then the signals go out through the axons. So they have some branching. It's a lot less branching than the dendrites though. And the axons are very specialized for transmitting signals very quickly. There's generally one axon with a little bit of branching per neuron. And the axon is enclosed in what we call the myelin sheath. Okay, we have something called terminal arborization. Arborization is a term that comes from trees, arbor, and talks about the branching that we have just at the very end of the axons. And then we have little swellings at the end of these axons called axon terminals, which is where chemical messengers are sent from these axons to, it'll be the dendrites of the next neuron. We can have 4 different types of neurons based on the different properties, what those neurons look like. So multipolar neurons have one axon, and lots of dendrites that are highly branched. And remember, the axons have a little bit of branching at the very end. Okay, so this is the most common type in the central nervous system. Then we have the bipolar. Okay, so the bipolar have one main dendrite that has some branching and one axon. Then unipolar have one dendrite and a much shorter axon. And then anaxonic neurons. They have lots of dendrites and pretty much no axons at all. We only find these in a couple specialized places, the retina, the brain, and the adrenal gland. So now we're going to be talking about transport in the axons. So we make a lot of proteins in that neuron body, in that cell body, and they need to be transported to the axons and the axon terminals. And they're going to be used and secreted from the axon and axon terminals. So these are used for repair. They're used to regulate the ions that are causing polarization, depolarization. There's also enzymes and then the neurotransmitters I was just talking about. So axonal transport is, we call this two-way passage. So we're sending things both directions. If we're sending things away from the neurosoma, away from that nerve body, we call that anteroretrograde. And retrograde is just the opposite. We're moving toward the neurosoma. So if we're going away from the neurosoma towards the axon, anteroretrograde, or anterograde, and then moving from the axon toward the neuron is retrograde. We have microtubules, specifically 2 motor proteins. These are really neat things. They're dynein and kinesin. Okay, so these allow different materials to be pulled along the microtubules. I know someone who has spent their whole career studying dynein, and it's really fascinating how these different materials get transported along a very long axon. We can also talk about the speed of transport. So we have either fast transport to and from the axons or slow transport only to the axons. Okay, so fast transport can go in both directions. And we're talking 20 to 400 millimeters per day. So this 400 millimeters, that's 4 meters. Okay, so that's a significant difference there, or distance, right? 20 millimeters, 2 centimeters, much smaller. Slow axonal transport only happens in the anterograde direction, so only to the axon away from the neurosoma. Okay, so this is how we move enzymes, and this is also how damaged nerve fibers can very slowly be regenerated. And moving on to section 12.3, here we're going to be talking about 6 types of cells that work with our neurons, and we'll be talking about the functions of those 6 types of cells. Then we're going to describe that myelin sheath that's really important for insulating and protecting the axons. Then we'll talk about some of the neurons that are unmyelated. And then we'll talk about how nerves, very slowly, and in some cases, are able to regenerate. We have about 1 trillion neurons in our bodies. However, the neuroglia, those glial cells, there's about 10 times more of them than there are neurons. Okay, so these neuroglia cells are very, very important. They have a protective function, working to keep the neurons safe and undamaged. They are integral in forming the network of all of the nervous tissue. In fetal development, with the neuronal system just being built, they help for the neurons to get to the proper destinations. When we're talking about mature neurons, they are covered with glial cells if they aren't in contact with the next neuron in the chain. So on this slide, we're going to be looking at the 4 general types of glial cells that are found only in the central nervous system. So we have oligodendrocytes, ependymal cells, microglial, and astrocytes. Okay, so oligodendrocytes, these are the things that make up the myelin sheath. And these are the things that are responsible for signals being conducted very quickly. Ependymal cells, these are found lining the cavities of the brain, and they secrete the cerebral spinal fluid. Microglials are in charge of damage repair, so they are looking to find and digest debris and also find any damage and then bring in the repair mechanism to fix any damage that they find. Astrocytes, these are the most abundant. So we have more astrocytes than we have the first 3 types. These cover the brain surface and they cover most of the non-synaptic regions of neurons. They have several different roles. Okay, so they can support general neuron function. They have extensions that go into the blood supply, and this is part of what forms the blood-brain barrier. They are responsible for producing and secreting growth factors that specifically work on nerves. They communicate with the nerves using electrical signaling. And this isn't really a function, it's more of a dysfunction. When a neuron gets damaged, the astrocytes can form a hardened scar tissue to take up the space where the neuron once was. When we're talking about the peripheral nervous system, we have different types of neuroglia. Okay, so here there are only 2 types. We have Schwann cells and satellite cells. So Schwann cells wrap around the nerve fibers, and they kind of make this mesh appearing substance. They wind around repeatedly. and they make what we call the myelin sheath. Okay, so similar to what we see the oligodendrocytes doing in the central nervous system, but here we're in the peripheral nervous system. And they also have a role in working to fix damaged nerves. Satellite cells go around the body of the neurons, and they provide insulation as the electrical currents are moving through, and they help to regulate the chemical environment that the neurons are operating in. So myelin is super important protein in your body. The myelin sheath is like an insulator around each and every nerve fiber. When we have the central nervous system, it's going to be formed by the oligodendrocytes. When we have the peripheral nerve system, it's the Schwann cells. Make sure you understand which one goes with what for your exam. And then the myelin sheath, we also want to be concerned with the plasma membrane here, which is about 80% lipid and 20% protein. The production of this myelin sheath has a special term called myelination. It begins very early in fetal development, the very beginning of the second trimester of fetal development, and then proceeds rapidly from there. It's not complete until late adolescence. And this is why, especially in infant formulas, we have to make sure that we have access to the different dietary fats, like omega saturated fats, unsaturated fats, to assist with that central nervous system development. So a little bit more about myelin here. In the peripheral nervous system, those Schwann cells, they kind of spiral around every single nerve fiber and can form more than 100 very thin layers. They don't have any cytoplasm between the membranes. They do have what we call a neurolemma, which is the outside coil. So we can see here the myelin sheath is made up of all of these very thin layers, and then the outermost layer, the neurolemma, is a little bit thicker and a little bit tougher. Going back to the central nervous system and the oligodendrocytes, those are the things that myelinate the nerve fibers in the central nervous system around the brain and the spinal cord. Okay, so here, in addition to protecting those cells, we're also anchoring nerve cells together. Okay, so we're making sure this nerve fiber is not only protected, but is connected to the adjacent nerve fiber. For every one nerve fiber, we need lots of these Schwann cells or oligodendrocytes to produce the myelin that's going to cover that nerve fiber. The myelin sheath has segments to it, so we have gaps between the segments of myelin, and we call those nodes of Ranvier. These internodes are little gaps between one area covered by myelin and the next area covered by myelin. And we have something called the trigger zone. And the trigger zone is very important in initiating the first nerve signal. And something called the axon hillock is involved in that nerve signal initiation. So, like most of the things that we're talking about in this class, when things go wrong, we end up with diseases. So, a tumor, generally speaking, is a mass of cells that is experiencing uncontrolled cell division, and it produces more and more cells and isn't getting the signal to stop dividing. So, we know that mitosis generally doesn't happen in neurons. And so we generally don't have tumors formed out of nerve cells. Okay, when we have brain tumors, they come from the meninges which is the covering of the central nervous system. And this is non-neuronal tissue that metastasizes and can invade and cause tumors in other organs. We also have gliomas. Gliomas are highly malignant, meaning they can spread to other parts of the body. They grow rapidly. And gliomas are especially dangerous because they degrade the blood-brain barrier, and that changes and decreases the effectiveness of chemotherapy. And so gliomas are more often treated with radiation or surgery to remove the glioma rather than chemotherapy. Multiple sclerosis, you guys have probably heard of this disease. So multiple sclerosis happens when we have deterioration of the oligodendrocytes, causing inferior myelin sheath formation in the central nervous system. So this would be in the brain and often in the spinal cord. So that myelin that surrounds, especially the spinal cord, becomes hardened scar tissue. And this changes the way nerve signaling is conducted, and the patient can have double vision or trembling. It can impact speech. It can cause numbness in different parts of the body. Generally, symptoms start to show up between ages of 20 and 40. And once it's diagnosed, once a person begins to have symptoms, it can be fatal within 25 to 30 years. Sometimes this attack and degradation of the myelin can be triggered by a virus, and then the virus causes an autoimmune response where the person's own immune system damages the myelin. Tay-Sachs is another disorder of the myelin sheath. This is a hereditary thing. We have an abnormally high prevalence of this disease in people of Eastern European Jewish ancestry. Okay, so this disease is much faster progressing than MS that we just talked about. Generally speaking, patients don't live past age 4. Symptoms are blindness, very poor eyesight, lack of coordination, lack of muscle tone, and it's caused by a missing enzyme. So when the person is missing the enzyme, they can't degrade some of the dangerous byproducts. Their lysosomes don't function well, and so they have waste products building up that impair nerve conduction. We do have some cells in the body that are unmyelinated. Okay, so in the peripheral cell, the unmyelinated cells are surrounded by a membrane that folds around the protein. So now we're going to move into talking about how quickly signals are sent along nerve fiber. And there are two things that impact this. The first one is the diameter of the fiber. So a large fiber has more surface area for conducting signaling, and so that signaling can happen faster. Also, if the cell is myelinated or not, with myelinated neurons conducting speeds faster. So we have small myelinated cells. Those are the slowest conducting. Then small myelinated, and those are much faster. And then faster still are large myelinated fibers. Okay, so we can see a very big difference in conduction speed here. So now on to regeneration of nerve cells. So regeneration can happen if the neurosoma is still intact. Okay, so we need that nerve body to still be there. The DNA needs to still be intact. The organelles need to still be intact. And we need some of the neurolemma to still be functional. We have 4 major steps in regeneration. First, the fiber that is past the injury. It disintegrates. Macrophages clean up the debris from the point of injury and onward. Okay, the next thing, the neurosoma swells, the endoplasmic reticulum breaks down, and the nucleus moves away from the center. The third step, the axon stump, kind of starts to sprout due to multiple growth factors that are added to the system. At this point, that far end, the axon end, is still continuing to degenerate. And then the Schwann cells, the basal lamina, and the neurolemma, they form what we call a regeneration tube. Okay, and this regeneration tube enables the neurons to regrow, going towards their original destination, and eventually may be able to reestablish the synapse that was lost when the injury happened. Okay, so then when that contact with the new regrown axon, with the dendrite that was there previously, that was the original target, at that point, the nucleus can return to normal, and any muscle fibers associated with this nerve can start to grow again. In some cases, this is not even possible. If it is possible, it will happen very slowly, generally up to 2 years at a minimum. And it may not be perfect. There may be lasting nerve pain. There may be mistakes made in this regeneration process.